Throughout the rest of the summit, we will be working together to explore these challenges and how to take action to solve them, and really thinking about how we can do that together. So this panel, which I'm really excited to have the chance to moderate, provides us with the opportunity to really start this exploration. We want to explore the opportunities in the areas of spreading, scaling, and sustaining promising practices, staff training, on-the-ground technical assistance, and in equity. And these topics will come up again and again today and tomorrow, and we will also add others, such as family engagement and working in family-based care environments. And so as you listen to these speakers, I encourage you to think about how you can use your role to facilitate the adoption of opportunities that will turn these challenges into successes. And that's really what we're talking about for Healthy Kids and Healthy Future. So with that, I'm going to start introducing our speakers. Carrie Dooyema, as was mentioned by Anne during her introductions, is with the CDC and is a behavioral scientist in the Division of Nutrition, Physical Activity, and Obesity at the CDC. And with that, let me turn it over to Carrie.
All right, so thank you. And good afternoon. I'm really delighted to be here with all of you to share some of the impressive progress that's been made over the last 6 years in this ECE setting, and another very hard act to follow. So maybe that's the theme. By the time we get to the end, it'll be way up here. So anyway. Before we get started, I just wanted to let you know a little bit about our division. So Anne shared a little bit, but I want to share a little bit more about our division and about our work at CDC. So we're the primary federal public health division focused on nutrition, physical activity, and obesity prevention through population-based work and strategies. We have many strategic priority areas, including getting kids off to a healthy start. So that's mainly our breastfeeding work and our obesity prevention and ECE work. We do this by supporting states and communities, but really states, to adopt and implement obesity prevention and embed that into their statewide systems. We also track and monitor these efforts. So success from our greatest challenges. That's a great way to start, really. Many of you in this room are very aware of the challenges of this work. So there's really little uniformity about how each state is organized and how their ECE system is organized. And the components of a state ECE system can be spread across numerous departments and organizations. We also know that nutrition, physical activity, and obesity prevention are not always top priorities for most ECE stakeholders, and they may also not be top priorities for ECE providers themselves at first. But great progress has really been made to embed obesity prevention into state systems, and that really creates the sustainable change that we're all trying to get to. So in the next few slides, I'll provide you with both data, because I am from CDC and we love our data, and we love maps. This has both presentation, but also examples of states who have really done great, kind of done the heavy lift and done some great work. I also wanted to introduce you to the CDC Spectrum of Opportunities, which is our framework for obesity prevention and ECE. It really kind of serves as a blueprint for states and communities to help ECE facilities in their jurisdiction meet national obesity best practice standards. The Spectrum of Opportunity, it identifies 11 different areas where states and communities can pursue to embed obesity prevention standards and supports into their existing ECE system. When the Spectrum was created back in 2009, we created some guidance materials and worksheets as well. And that really can help states get started. It helps them assess the ECE landscape that's at their state or at their local jurisdiction level. It helps them build their partnerships to get started in this work, or even brings them back after they've been in this work for a while. It identifies avenues that they can pursue, and also it helps them plan for implementation when they've figured out where they want to go. So this is the spectrum. Each different color represents a different way to improve nutrition, physical activity, breastfeeding, and screen time policies, practices, and ECE facility environments. Before we get into the actual data, I wanted to let you know about a report that we're working on at CDC. It's called the State Indicator Report. And this report will really just provide a snapshot of the obesity prevention work along the spectrum and highlight successful state efforts. The information from the report came from both publicly available data and also from a survey that we did to state agency, 2 people in each state at state agency staff level. We had respondents from all 50 states and DC, and we had a great response rate, and so it really shows people are really interested in this topic. So the first spectrum area, now for the evidence. The first area I wanted to highlight is the licensing and administrative regulation area. And I really wanted to credit the work of the National Resource Center for Health and Safety and Childcare for their work in this area. About 6 years ago, they brought a panel of experts together and they developed 47 high-impact obesity prevention standards. And then in 2010, with funding from the Maternal and Child Health Bureau, they started annually reviewing and rating each state's licensing regulations to see how well the licensing regulations met up with the standards. This map. So in 2010, when we started, they went through all the states, and now 24 states from 2010 to 2014 have updated their licensing. So it's half the states. Yeah. And really, all of these states made improvement to the 47 high-impact standards. And I wanted to highlight, just kind of give you a glimpse of some of the large improvements in a couple of states. So we have Rhode Island. So in 2010, when they looked at the center-based care regulations, they met 2 of 47 standards. And in 2013, when they updated their center-based care regulations, they now meet 20 of 47 standards. So, an 18-point improvement in one act. And then New Jersey, another state I wanted to highlight. So New Jersey, the large family child care homes met 1 of 47 standards in 2010, and now they meet 15 of 47 standards. And so we really are looking forward to additional improvements in 2015 and 16, such as Colorado, who passed licensing to disallow all sugar-sweetened beverages in ECE. For the CACFP spectrum area, the Child and Care Food Program, we sent the survey to each state CACFP director, and we found that more than half the states encouraged nutrition standards that actually exceed the current federal requirements for ECE providers who participate in ECE. So you can see the graph there, so we're halfway. And then the next part we found out is that we found that almost half the states provide some type of training for ECE providers who participate in CACFP around the obesity prevention topics. Another area is quality rating and improvement systems, and I'm sure Sherry will speak to those. QRIS is a systematic approach for assessing, communicating, and improving quality in ECEs, and we found that 37 states had systems, and about 28 of them include some aspect of obesity prevention in their standards. South Carolina would be another example I'd point out to you. Another area which you'll hear more about from Claudia in a few minutes is professional development. So we found that 42 states have online obesity trainings that count towards professional development credits for ECE providers. So this is really useful in improving ECE providers' knowledge and competencies in these areas. Some states have created their own state-specific training opportunities, and other states recognize the nationally recognized Better Kid Care from Penn State. This is one of my favorites. So we found that the majority of states, 46 states, are providing or promoting specific interventions, curriculums, or programs to the ECE providers in their state around obesity prevention. So some states have done the heavy lift of actually creating, branding, and disseminating their own programs, and you can see the examples at the bottom of Missouri. Oh, sorry. I get so excited. Missouri, Wisconsin, and Georgia at the bottom of the screen. And then we also found that other states are promoting or providing well-known intervention programs or such as NAPSAC and Let's Move Childcare. And these are great ways to promote change and support EC providers at the facility level. Evidence to access to healthy environments is another spectrum area, and one way that we can support that is through farm to preschool work, which will also be covered in a breakout session. So when we asked states, we found that states are supporting farm to preschool in very sustainable ways, such as dedicating state agency staff time or funding, and they're also using and forming coalitions to support farm to preschool work. We found that they also reported a lot of local level initiatives happening at the local level as well. And finally, we found that about 20 states have some type of recognition program, such as a healthy childcare designation or a breastfeeding friendly childcare designation. And these designation programs can really improve the quality of the ECEs who participate in these programs. And we found 39 states have some type of group or task force that is kind of addressing obesity prevention in ECE or in the early childhood period. So it really means states are pulling together these diverse stakeholders and focusing on this area to advance the work. So moving forward, as you see, many states have worked successfully on many of the spectrum areas, and a lot of progress has been made to embed these things into the ECE system itself. We're looking forward to improved data sources so we can track change. We love data, so improved data sources would be really nice. But mostly we're really looking forward to the continued progress of states and communities. And we want to commend everyone for your efforts, because without your efforts at the state and local levels and your dedication, these changes wouldn't really have been possible. So thank you.